Upon the completion of this video, you should be able to evaluate the portal venous system sonographically and with Doppler images to evaluate for acute versus chronic portal venous thrombosis and some of the pathophysiology behind that. Cavernous transformation, also known as portal cavernoma, that occurs when the native portal vein is thrombosed. And then you're going to have a whole robust amount of collateral channels that are going to develop right there in the porta hepatis to bypass that occlusion. So again, main portal vein thrombose, and then used generally chronically because now these collaterals need to form and develop there right around it, and you're going to get spectral flow, portal vein appearance flow in those, and you're not going to be able to see main portal vein with color. So some of our signs of cavernous transformation: non-visualized portal vein there, and you're going to see those robust amount of collateral channels right there as a result of this that are going to appear right there at the porta hepatis. So again, we're going to have that chronic thrombosis with cavernous transformation, and that's just going to appear as small echogenic lumen with multiple tortuous collateral channels, as you can see right there within the porta hepatis. So these are going to form kind of like a bypass route from the splanchnic veins to the intrahepatic portal veins. So it's going to go around the thrombosed portal vein and into the intrahepatic portal veins. And the good thing to note that this transformation may take up to a year to develop. So you can kind of see it's more of a chronic advancement as opposed to something that just happens immediately or acutely, right? So it's more of a chronic development, sometimes taking up to a year. Notice when we sample or do a Doppler waveform of one of the channels of the cavernous transformation, we're going to get a pretty typical portal venous waveform that we typically would see in the main portal vein. So this is what we'd expect to see when sampling our cavernous transformation channels. This is acute portal vein thrombosis. Look at the echogenic material within this large dilated vein. You can see the blood flow going around the peripheral there on this patient here with the color. All right, just a case study here. This 48-year-old woman with history of alcohol-related cirrhosis, and we've already identified esophageal and gastric varices, complaints of constant right upper quadrant pain for 2 days, acute new pain. Appears older than stated age, mildly undernourished, talkative, cooperative, no acute distress. Lab values, elevated liver enzymes. So you can kind of see here, portal vein, we're not really getting any flow in there, right there. And we're just kind of demonstrating that at the main portal vein, that we're not getting any flow. Did a measurement here. I know we see on this final report coming up that it says possible cavernous transformation visualized on this. I don't really necessarily agree with that. We kind of have some limited image here for my example. We should put show a spectral Doppler of this vessel here to determine or not if that is the hepatic artery in this image here. And I don't really see our cavernous transformation that's really occurring that you would see at the porta hepatis in a more chronically occluded portal venous situation, which I did say up to a year it takes for it to form on previous slides. That is true. Sometimes that is seen, and it does take up to a year for our cavernous transformation to take place, but it has been seen and demonstrated, just so you guys do know, as early as within 6 to 20 days following acute thrombosis. So just for something to be aware of there, it does take up to a year, but it actually has been seen. You can see it, within 6 to 20 days following patients with acute thrombosis. And another good fun factor on that is, it's actually most commonly seen in patients, not commonly seen in patients with cirrhosis or other liver diseases. It usually kind of occurs more frequently in patients with healthier livers.